Lead. Objectives. Understand the following: health effects and protective measures. General. Although employees and contractors are not expected to be exposed to lead-containing materials during their normal activities, it is possible that other work in the mill could result in a potential exposure. Lead-based paint may be found in older structures built before 1978. Lead exposure can occur through the inhalation or ingestion of lead-containing dust that is generated during construction, repair, or renovation activities. The primary lead hazard in mills involves the disturbance of lead-based paint. Paint must be tested in order to determine if it contains lead, and paint that has not been tested must be assumed to contain lead. Health effects. Lead adversely affects numerous body systems and causes forms of health impairment and disease that arrive after periods of exposure as short as days, acute exposure, or as long as several years, or chronic exposure. The frequency and severity of medical symptoms increases with the concentration of lead in the blood. Common symptoms of acute lead poisoning are loss of appetite, nausea, vomiting, stomach cramps, constipation, difficulty in sleeping, fatigue, moodiness, headache, joint or muscle aches, and anemia. Acute health poisoning from uncontrolled occupational exposures has resulted in fatalities. Long-term or chronic overexposure to lead may result in severe damage to the nervous, urinary, and reproductive systems. Protective measures. Employees and contractors are not permitted to perform lead removal activities. If lead removal activities are performed near our work area, coordination between the mill, the lead removal contractor, and our personnel must be a priority. If lead removal activities by other contractors are being performed, it should be noted on the pre-job safety assessment, and all employees and contractors should understand that entry into a barricaded area where lead removal activities are being performed is not permitted. If exposure does occur, report the incident to your supervisor immediately. Quiz. 1. Lead exposure can occur through the inhalation or ingestion of lead. A. True. B. False. 2. The primary lead hazard in mills involves the disturbance of lead-based paint. A. True. B. False. 3. Common symptoms of acute lead poisoning are loss of appetite, nausea, and vomiting. A. True. B. False. 4. TRIASIM employees and contractors are not permitted to perform lead removal activities. A. True. B. False. 5. If exposure does occur, report the incident to your supervisor immediately. A. True. B. False.